Good morning. I am Dr. Mon, one of the junior doctors here in this GP clinic. Can I please confirm your name and age first?
Uh, Good morning, doctor. I'm Jennifer Paulson. I'm 28, but you can call me Jennifer.
Okay, Jennifer. So what's brought you here today?
Um, Doctor, my partner, Lena, and I have always wanted a baby of our own. And so we've been, planning to start a family. Um, and we'd prefer to have a baby who's biologically, related to either of us if possible. So I'm here to get some advice and information about our options from you.
Of course, I'd be happy to help you, Jennifer. But and also there are a few different options available to have a baby. Okay. But first of all, I'd like to know if you two have decided who is going to get pregnant.
Yes, doctor. We've talked it over and we are in agreement on that. Since I'm 28 and Lena's 32, and she is the chairperson of the board of directors in our dad's company, and she's got plenty of jobs, to keep her busy. So we've decided that I should carry the baby and give birth, and she'll pay the full cost of everything.
That's great. Well, to assess your fitness level and to determine your best options to conceive, I'd like to ask you a few questions first about your general health, if you don't mind.
Um, Not at all, doctor. Please go ahead.
Okay. So, would it be your first pregnancy, or have you ever been pregnant before?
No, this would be my first pregnancy, doctor.
I see. And do you have any medical conditions that I should be aware of?
No, I haven't had any health problems.
Okay. And have you ever been diagnosed with any medical condition affecting your reproductive health?
No, doctor, because I get like regular visit actually
Hmm.
to the gynecologist, and she said there were no abnormalities with my womb.
Excellent. Okay. I'm going to ask you some questions that I ask to all patients to help, get a sense of their sexual health. Would that be all right?
That's okay, doctor. Please go ahead.
Okay. So, Jennifer, have you ever been tested for sexually transmitted infections?
Um, yes, doctor, and the tests were negative.
That's great. And have you previously used any forms of contraceptions, or do you use anything to protect yourself from sexually transmitted infection?
Actually, no, doctor.
Okay, it's okay. And have you ever picked up any serious physical injury?
No.
Okay. And any operations or procedures done before?
Not really.
Okay. And have you ever been hospitalized for any reason before?
No, doctor, I've never been in hospital.
Right. Are you currently taking any prescribed medications or any over-the-counter drugs?
Yes, doctor. Actually, I already started, taking folic acid and vitamin
Mhm.
tablets a month ago, since we are planning to have a baby.
Fantastic, actually. Uh, well, Jennifer, do you also have any allergies?
No, doctor.
Okay. Are you aware of any genetically problems in your family?
No.
Okay. Now I'm gonna ask you some personal questions about your periods. Okay.
Okay.
Do you have a regular menstrual cycle?
Yes, I have regular periods.
Okay. And how often do you have period?
Just once a month, doctor.
Have you noticed any bleeding between periods?
No.
Hmm. And how long does a period last?
Um, my period can last, up to like 4 to 5 days.
Okay. And have you ever experienced painful periods?
No, doctor. I think I'm
Okay.
quite lucky.
Great. So, if you don't mind, I'm going to ask you some more personal questions about your sexual life.
Not at all, doctor. Don't worry. Please, feel free to ask me any questions that you need to ask.
Thank you, Jennifer. So, may I know your sexual orientation, Jennifer?
Actually, I am a female homosexual
Hmm.
lesbian. Lena
Okay,
and I are a lesbian couple.
I see. And are you two in a stable relationship?
Yes, we lived together for 3 years, and we are like each other's best friends. And then we decided to enter a civil partnership 2 years ago.
Congratulations, Jennifer.
Thank you, doctor.
Okay. And do you smoke?
No,
Okay. What about alcohol?
no, doctor.
Okay. By any chance, do you use any recreational drugs?
No, I've never touched them.
That's great. And Jennifer, what's your diet like on an average day?
I always try to eat a healthy, balanced diet, doctor.
Excellent. Well, thank you very much for answering all my questions, Jennifer. And now I would like to do general physical examination and I'll check your vital signs. That be all right?
Okay, doctor. Should I roll up my sleeve?
Okay. That's all done, Jennifer. Thank you very much. And on examination, everything seems normal. That's great.
Okay, that's a relief, doctor.
Yeah. So, Jennifer, I understand that you prefer a biological baby to either of you. Is that correct?
Yes.
All right. And before proceeding further, do you have any preferred method?
Uh, Actually, doctor, since we started planning to start a family, we did research on the web
Mhm.
to learn about uh, possible options like adopting or fostering a baby. And we both know that's not what we want. And so, could you please explain if there are, any other methods of conception?
Sure. And I'll explain what other options you have to become pregnant. Okay. And the first one for female same-sex couple is called donor insemination. Have you ever heard about it before?
No, doctor.
No worries. I'm here to explain to you. So, since you're a lesbian couple, we need a donor sperm, either from a male friend or anonymous sperm donor. And it is a procedure in which the donor sperm will be inserted into your womb when you're ovulating. Okay, we'll be inserting the donor sperm using a small plastic needleless syringe, and it's known as intrauterine insemination, also known as IUI. Are you following me, Jennifer?
Mm-hmm. Yeah, that sounds not bad, doctor. But how can we get donor sperm if we don't have a male friend who is willing to donate sperm?
Yeah, but if you don't have anyone who can donate sperm, there's nothing to worry about because it's better to get donor sperm either from a licensed fertility clinic or a sperm bank where the donor sperm has already been screened for any infectious disease like STI and also from genetically inheritable diseases as well.
Hmm, that's great, doctor.
Okay. And the second method you can consider is in vitro fertilization, also known as IVF, which is another procedure where eggs are combined with a sperm in a lab and not inside the body.
Yeah, that sounds like the better choice. So is there any other method, in which Lena's eggs are taken and fertilized with the donated sperm and the resulting embryo is placed into my womb?
Of course, the fertility treatment option most lesbian actually go for is called reciprocal IVF, which is also a type of IVF, and it's also called shared motherhood because the eggs taken from one partner and the donor sperm are used to create an embryo in the lab, and then the other partner carries the pregnancy. So in this way, both partners in the couple can be biologically participate in the pregnancy.
Yes, that's
Okay.
exactly, how we want to conceive our baby. And I'm glad that, yeah, that kind of treatment is available.
Yeah, I know. Well, I know that option actually offers a unique opportunity for lesbian couples in their family, and so that they can involve together in this journey, you know.
Mhm.
Okay. And by the way, do you have you also have you ever heard about another method called co-parenting?
Uh, yes, doctor. From what I understand about co-parenting is like two or more people like sharing parenting, responsibilities for a child.
Yes, that's correct. And it's indeed it means that two or more people team up together to conceive and parent the baby all together. Right. So, Jennifer, have I made everything clear to you?
Yes, doctor. All the information you gave me today would be very helpful for us.
That's good to know. And do you have any other concern or any questions?
Yes, doctor. We also have some concerns about legal rights as parents. So
Okay.
can you provide some guidance on this?
Certainly. Okay. And indeed, it's advisable to get legal advice to establish parental rights and responsibilities at an early stage of your planning. For example, sharing the responsibility of the education of the child, or the splitting the financial costs and spending time with the child, and etc. And in these cases, I can refer you to to legal professionals with experience in these kind of situations, and of course in the family law and reproductive rights, if you like.
Okay, yeah, that sounds like a good plan, doctor. Thank you so much for your
Okay.
help and guidance. We really appreciate it, and I'll talk to Lena about everything we've talked about today. Uh,
Mhm.
and then we'll come back next week to see you again. And we should have made a decision by then.
You're welcome, Jessica. So, um, you can reach out to me if you have any further questions or need any additional information. And also, going to give you this leaflet that contains all the information that we have discussed today so that you can read it at your own time. Okay?
Okay.